Hello, my name is Jennifer McAllister. I'm the Fellowship Program Director of the Adult Pulmonary and Critical Care Medicine Fellowship here at The Ohio State University Wexner Medical Center. We're looking forward to meeting you at your upcoming interview. To prepare for this day, please review the following program overview. We have prepared some essential information that we feel will help you make the most of your time with us. First, it's my pleasure to introduce you to the other members of my fellowship leadership team. I've had the privilege of being a part of this team since joining the faculty here at Ohio State in 2007. I served as the Associate Program Director until 2014 when I transitioned into my current position as the Program Director. Even after all of these years, this remains one of the most rewarding aspects of my job. Dr. Josh Englert serves as our Associate Fellowship Program Director. A funded physician investigator, his passion for mentorship and his enthusiasm for professional development provide an invaluable set of skills for our fellows and a robust foundation for our curriculum. And then last but certainly not least, Dr. Avi Cooper, our Assistant Program Director, is a talented and compassionate medical educator who has an innovative approach to curriculum delivery and an really uncanny ability to connect with learners through social media. If you have not found his tutorials and podcast, I really encourage you to do so. What you can see here is that we are a large division with 50 clinical faculty and 11 research scientists in the division. We've been fortunate to have undergone a period of near continuous growth over the past several years under the leadership of Dr. Jeff Horowitz, our division director, and the direction and vision of Dr. Rama Malampalli, the chair of medicine, who is also a well-funded pulmonary critical care physician. We have a large fellowship with 18 fellows in our core pulmonary critical care program, including 2 who are currently doing combined training in pediatric pulmonary and adult pulmonary critical care medicine. We are fortunate to be able to collaborate with the other fellowship programs that you see identified here on the slide, including our Interventional Pulmonary program, a nationally recognized sleep program, and a very active and new lung transplant program. Together, these additional training programs really provide a robust interdisciplinary environment that is rich with opportunities for collaboration for both clinical training and research. This slide introduces you to the remaining leadership in the division, including our associate clinical and research directors. It also introduces our extremely important program coordinator, Tina Olson, who has been instrumental in coordinating and organizing the virtual interview process for us. Tina, we want to thank you for everything that you've done for us and everything you will do to ensure that our applicants have an amazing experience with us. If there are folks on this slide that you would like to meet and you don't have the opportunity to connect with during your interview day, please let us know and we'll be more than happy to facilitate a meeting. Know that they are available and they are more than happy to meet with you. Like most academic medical centers, we have a tripartite mission. We are invested in training the next generation of physicians and supporting our existing medical community through providing outstanding clinical care and advancing the science of investigation. We're going to spend most of our time today focusing on that educational mission because that's why you're here today, to learn about our fellowship program. But we do want to make sure that you leave this session with us with a good sense of the clinical and research opportunities that are here, because those really will be integral to your choice ultimately in a fellowship program. I think what you are probably starting to find as you begin your journey along the interview trail is that what really differs in academic medical centers is one of two things, is how much time an individual fellowship training program chooses to dedicate to each of those missions within the fellowship program itself, and what resources really exist to support fellows along this journey. And so I hope by the time you're finished with this presentation and with your interview day with us, you'll have a good sense of where we really fit. To start these conversations, I'd like to take the opportunity to introduce you to the wide range of diverse and robust clinical opportunities that would be available here at the Wexner Medical Center. We have traditional programs in obstructive lung disease, cough, and interstitial lung disease. We also have more specialized programs in pulmonary hypertension and lung transplant, complemented by advanced procedural training and the opportunity to do additional fellowships that I mentioned at the beginning of this program. As you think about what fellowship training here might look like for you, I encourage you to ask specific questions and reach out to faculty who might be able to really help you dig deeper into what specific training in these areas might look like. This list includes all the topics in the division where we have active funding and faculty mentors. If you are interested in learning more about these, then please let us know during your interview, and we'll be happy to connect you with faculty who can tell you more about the projects and ongoing research in these areas. We have faculty who are excited to be potential mentors for you and would love to talk to you about their area of active research. Now that you have that background information, we're going to switch gears and dig deeper into the fellowship program itself. My goal with the fellowship program here at Ohio State is to train leaders in pulmonary and critical care medicine. Whether you envision yourself as a clinician specialist, an investigator, or an educator, I want you to set the bar as high as you can and then to aim to be the best that you can be. I also aim to provide a rich and diverse educational environment to help you meet your utmost potential. It's my commitment to you that we will provide the necessary structure and mentorship and flexibility to help you meet your individual career goals. This represents the general overview of what a typical 3-year schedule might look like with us here at The Ohio State University. Our first year is almost exclusively clinical for our fellows. We do have 2 months that are not, including our Pulmonary Med School month and our Introduction to Research curriculum, which we will tell you more about in subsequent slides. The second and third years are a combination of research and clinical time, the months of which are divided up in a ratio that we determine through mentoring conversations and individual career development plans with our fellows to meet their long-term career goals. Our fellows spend the first 2 years in a continuity clinic, 1 half day per week, paired up in a mentor-mentoring relationship with one faculty over a 2-year period of time. At the end of that 2-year period, they turn that panel of patients over to a new first year and they move on to their subspecialty clinics during their 3rd year, where they spend 6-month blocks rotating through a variety of subspecialty clinics, rounding out their outpatient pulmonary skills. For fellows who are interested in building a career as a potential physician investigator, the opportunity to pursue a 4th year through a variety of funding mechanisms exists and is encouraged depending on the fellow's individual career goals. I take a lot of pride in the flexibility we have in the curriculum here at Ohio State. We are a big enough fellowship where we are able to really support an individualized training approach. With 18 fellows in the program, we really work with each of you to really focus on long-term career goals and individual mentoring. You'll hear from Dr. Englert later in this presentation about the fellowship tracks that we offer, which provide specific mentored approaches to our fellowship training. As an introduction to that, I will say that we are able to offer between 18 to 24 months of clinical training, depending on a fellow's long-term career goals. And as a complement to that, we can offer 12 to 18 months of research or scholarship time. For those fellows who really are interested in beginning a career in investigation in earnest, we have the opportunity to support an additional 4th year and strongly encourage fellows to do so. As I mentioned on the previous slide, our first year of training is almost exclusively clinical. but it does include some unique learning opportunities that we're exceptionally proud of. The first month of fellowship here at OSU is our Pulmonary Med School month. This is a robust hands-on orientation month that includes a wide range of educational opportunities. And we have an introduction to research curriculum which spans 4 weeks, usually in the months of January and February, where our fellows begin to seek mentorship and begin to think about their long-term career plans and potential scholarship opportunities. In addition to this, all first years are given the opportunity to attend one professional society meeting during their first year. Because of scheduling and prioritization for second and third years, all first years are assigned to attend either CHEST or the Society of Critical Care Medicine. The first year fellowship is a busy clinical year that provides a solid foundation for all of our fellows, regardless of their long-term career goals and fellowship track. It begins with Pulmonary Medical School and includes the Research Month, both of which you'll learn more about on subsequent slides. This clinical training occurs almost exclusively on the Wexner Medical Center campus, which is one comprehensive campus including the Ross Hart Hospital, the James Cancer Hospital, and University Hospital, which currently includes Doane and Rhodes Hall. If you were here in person with us today, you would see the active construction of our new University Hospital tower, which is anticipated to open in 2025. The typical first-year fellow will complete 3 to 4 medical ICU months and 3 to 4 inpatient consult months, and rounds out the year with the remainder of the rotations that you see noted on the slide here. MICU North and South are general medical ICU months in the University Hospital, which we preference for our first-year fellows. These standard teaching months include an attending a fellow, residents, interns, and medical students. We tend to defer the oncologic ICUs for our upper level fellows, allowing our fellows to work with advanced practice providers in these specialty ICUs at a time later in their training. The Ross and James consult services serve their specialty hospitals and share inpatient consults with the University Hospital, ensuring that each fellow that rotates on these services has the opportunity to not only learn from the specialty population that they serve, but also to maintain a growing knowledge base of general pulmonary in a consultative manner. All first-year fellows participate in an ambulatory pulmonary and sleep month that includes 2 weeks of outpatient sleep medicine, the opportunity to care for adult cystic fibrosis in the ambulatory setting, and an introduction to our subspecialty clinics that will be expanded upon during the third year of fellowship. Each first year also participates in a PFT procedure month where they develop basic skills in bronchoscopy, thoracentesis, and other core pulmonary procedures. After becoming comfortable in these basic pulmonary procedures, these fellows are then given the opportunity to begin working with our interventional pulmonary group, where they can begin exploring more advanced procedures such as EBUS. Some of the first year fellows will spend 1 month at OSU East, which is one of the hospitals in our healthcare system not located on the main campus. The hospital, which is located approximately 10 minutes away from the main campus, serves a socioeconomically disadvantaged population and provides an important opportunity for our fellows to connect with the local community and to serve that patient population. We currently staff a medical ICU there, a pulmonary consult service, and rotate through an LTAC. Each first year fellow will do 1 block of night float, which is strategically placed at the end of the first year so that the fellows are competent in procedures such as chest tubes and airways before they begin this experience as a first year. We also offer risk coverage for all of our fellows 365 days out of the year. Our first years do not participate in this coverage, but I do include it on this slide just so that I remember to remind you that this coverage is available. It's important to us as a program that we have risk coverage available throughout the year so that we can focus on the wellness of our fellows if they need to take time away for family or personal emergencies. Fellowship begins for us in earnest on July 1st, and with that begins our Pulmonary Med School month. This is a fantastic month for our fellows to focus on core procedural training opportunities, team building, and other collaborative activities. The fellows have no primary patient care responsibilities during this month, but they do have the opportunity to work collaboratively with the other upper level fellows multiple times during this month, practicing procedures and learning the mechanics of our hospital. The core curriculum for this month emphasizes procedures and basic physiology, which for many fellows is something that has not been thought of in quite some time. We also take this opportunity to allow our fellows to complete all of the onboarding activities that are required for the hospital. We introduce them to our electronic medical record, the pulmonary function testing software, and other sort of just essential housekeeping things. The fellows are oriented to their outpatient clinics, and they, as I mentioned, spend time shadowing with our senior fellows on our inpatient services. It provides a fantastic opportunity for the first years to spend just a lot of great time together and really develop a sense of community, which, if you ask me, I think is one of the most important, if not the most important, benefits of this time together. This further highlights the details of the curriculum of the Pulmonary Med School month. As I mentioned, there's an opportunity to review some of the basic physiology principles that many fellows have not considered for quite some time. While that may not seem exciting to some of you, it's an important foundation to review as our fellows really become primary teachers in many settings throughout the medical center. There's an emphasis on team building and leadership, including code blues and other situations in the hospital. And there's really a primary emphasis on just hands-on procedural training. The fellows have the opportunity to participate in simulation-based training in basic and advanced airways. There's a full bronchoscopy course directed by our Interventional Pulmonary service here, and a 2-day ultrasound course, which is a Midwest collaboration with the programs in Cleveland. And then there's a very well done communication workshop in collaboration with palliative medicine and medical oncology here. These opportunities to really bring different training programs together, I think, is one of the big benefits of this month. And then finally, I will just reiterate, to me, I think one of the most compelling benefits of this course is the opportunity to really solidify the sense of team and family. One of the things that I love the most about our program and our fellows is this strong sense of community and support, and that starts here in the first 4 weeks of our curriculum when the fellows have the opportunity to spend this really dedicated time together. The Med Center is a big place and our clinical services are busy, and it's easy for individual fellows to feel lost and really individual once they begin their clinical services. And having this opportunity to spend this time together really forms those very important relationships, especially for fellows who don't do their residency here. And to really form that core foundational relationship sets the tone that the fellows are all on the same team. They're in this together, and they know who to look for when they need help.
Hi, my name is Josh Englert, and I'm the Associate Program Director for the Pulmonary and Critical Care Medicine Fellowship here at Ohio State. I've been at OSU for nearly 5 years, and working with our fellows is one of the best parts of my job. I'm going to pick up where Dr. McAllister left off and tell you a little bit more about the second non-clinical month during the first year of our training program. We call this Research Month, and it's a month-long break from clinical service to give fellows time to begin to think about their career development and think about life after fellowship. The very practical goal of this month is that fellows identify both a mentor and a scholarly project that they will work on during the second and third years of the fellowship program. In order to facilitate this, we have faculty mentors who are eager to work with pulmonary fellows, both from within the division and outside of the division, come give overviews of potential research opportunities. If the fellows find these projects interesting, they typically contact the faculty and have a cup of coffee and talk in more detail. and until they find a project and a mentor that seems like a good fit. In addition to these networking opportunities, there are didactic programs that are focused on career development and very practical questions like how to choose a research project or how to pick a research mentor. Also during this month, fellows learn more about our advanced degree programs. There are overviews from the various master's programs that Dr. Cooper will talk about more on subsequent slides. And fellows also begin the process of selecting the track that they would like to pursue. Finally, as Dr. McAllister would say, there is a hidden curriculum to this month, and that curriculum is really one of providing some time for wellness in order to focus on some of the life activities that have been put on hold during your busy clinical months. It's also another opportunity for the first-year fellows to come back together as a class, as they did during Pulmonary Medical School, and really have a chance to catch up and spend time with one another. Prior to beginning the second-year fellowship, our fellows will select from one of the 5 different tracks shown here on this slide, depending on their long-term career goals. These tracks allow us to provide a personalized and individualized career development plan for a wide variety of career options following graduation. Although we have recently revised and renamed some of these tracks, it is important to note that we have a long track record of training fellows to successful careers in each of the pathways shown here. The first 2 tracks are our research tracks. We have a basic translational research track as well as a clinical health services research track. Both of these tracks provide a significant amount of protected time for fellows to pursue original research, with the ultimate goal being to become a funded investigator at an academic medical center. Fellows on these tracks are required to compile a research advisory committee, which consists of both their primary mentor or mentors, as well as several additional faculty members with expertise relevant to their area of investigation. When these fellows on these tracks complete fellowship, the goal is for them to be able to submit a NIH Independent Career Development Award, either a K08 or a K23, depending on their chosen area of research. Although the primary focus for these fellows is research, fellows on these tracks are encouraged to identify a clinical niche to gain additional expertise, often in an area that is particularly relevant or complementary to their research. Next up is our clinician educator or administrator track. And as the name would suggest, this track is designed for fellows that wish to pursue a career as a medical educator or a healthcare administrator. These fellows spend a significant amount of time during the second and third year developing the skills necessary for these career paths. They often pursue scholarly projects in areas such as curriculum design or innovation, or health economics for those interested in administration, or perhaps quality improvement. Similar to the fellows on the research tracks, fellows on the clinician educator administrator track are encouraged to develop a clinical niche or an area of clinical expertise that may be relevant to other aspects of their career. Finally, we have our last 2 tracks, the clinician scholar track and the clinician specialist track. These tracks are designed for fellows that are interested in pursuing a career as a clinical expert, either in an academic setting for those on the clinician scholar track, or in the community setting for those on the clinician specialist track. Fellows on these tracks will often pursue an area of expertise in one of the subspecialties within pulmonary and critical care medicine. During the second and third years, fellows on these tracks will spend additional time honing their clinical skills and developing the expertise needed to become an expert clinician in their chosen area of interest. For example, a fellow that may want to become an expert in the field of pulmonary hypertension may do some electives where they spend time learning how to read echocardiograms, or perhaps some additional time in the cardiac catheterization lab, learning how to perform right heart caths. Although the scope of the research projects for these fellows may be more narrow than those on the research track, fellows on each of these tracks often make important contributions to the scientific literature through performing retrospective clinical studies or meta-analyses or developing clinical practice guidelines under the mentorship of a faculty member. Shown here is a breakdown of the research and clinical time during the second and third years for each of the different tracks. As mentioned previously, the research tracks provide the greatest amount of protected time for those fellows to make progress with their research, publish manuscripts, and apply for grant funding. The clinician educator, administrator, scholar, and specialist pathways all have additional clinical service, but it is important to note that this isn't simply additional ICU time or time on our consult service. This additional clinical time is selected from a wide variety of electives by each fellow to specifically develop the clinical skills needed for their chosen career path. Often fellows, especially on the clinician scholar and clinician specialist pathway, will obtain additional experience in the outpatient setting, as the subspecialties they choose to pursue are often primarily focused in this area. Shown here is a breakdown of the research and clinical time during the second year of our fellowship. Depending on the tracks selected, fellows will have anywhere between 6 to 10 blocks of research or elective time and 3 to 7 blocks of clinical service. There are several mandatory rotations during the second year, including rotations in our surgical intensive care unit, on our lung transplant service, as well as our pulmonary hypertension service. Fellows also spend time on the night float service during the second year, which many fellows cite as some of the most valuable training experiences during their fellowship. The second year also brings opportunities to attend national meetings, including ATS, CHEST, or the Society of Critical Care Medicine. And on the right-hand side of the slide, we're showing you some pictures of our fellows hard at work. The picture on the top is a airway management simulation training session, and on the bottom are some of our fellows hard at work in the lab. Here we have a breakdown of the research and clinical time during the third year of fellowship training. During the third year, fellows, again, depending on the track, will have anywhere between 5 and 9 blocks of research or elective time and 4 to 8 blocks of clinical service. Fellows are required during the third year to rotate through our cardiovascular ICU, our neurocritical care ICU, and to spend some additional time on night float. As is the case during the second year, fellows have an opportunity to attend any number of national meetings, including ATS, CHEST, or SCCM, and often fellows will take the opportunity to attend a subspecialty meeting or perhaps a more research-focused conference, such as a Gordon Research Conference or a Keystone Symposium. Another one of the strengths of our fellowship program is the robust procedural training that our fellows get while they're here. Our fellows have access to a wide variety and large number of procedures during their fellowship. Fellows do a large number of bronchoscopies, airway management, chest tubes, and thoracenteses. What we're showing you here on this slide are some of the average numbers of procedures that fellows log. And as Dr. McAllister sometimes likes to say, we don't have any shortage of procedures, but what we sometimes have is a shortage of logging those procedures. So the point being is that some of these numbers may be an underestimate. In particular, our fellows likely do hundreds of thoracenteses throughout their training, but often they'll stop logging after the first 25 or so. Our fellows graduate from this program with strong airway management skills, with opportunities for intubations in the medical intensive care unit and during their night float rotation. Fellows learn how to do both pigtail and surgical chest tubes. They have access to a wide variety of ICU procedures, including central line placement, dialysis catheter placement, arterial lines, etc. Our fellows, during their PFT procedure month, will read hundreds of pulmonary function tests and graduate very comfortable interpreting both these as well as cardiopulmonary exercise tests. I wanted to take just a minute to tell you a little more about our IP service, as this is often a question that comes up during interview days. We are very fortunate to have a busy interventional pulmonary service with 4 full-time faculty and 1 fellow. There is an excellent opportunity for our fellows to obtain additional procedural experience during the PFT procedures rotation as a first-year fellow and during an elective during the second and third year of fellowship. Our IP elective is 2 to 4 weeks in length, and fellows can really obtain a significant amount of procedural experience during this time. Fellows often use this time to get additional experience with advanced bronchoscopic procedures, such as transbronchial and endobronchial biopsies, as well as pleural procedures, such as chest tube placement. Fellows frequently graduate from our program competent in these procedures, as well as EBUS-guided lymph node biopsies, and in some instances, percutaneous tracheostomies. Our fellows have access to a wide variety of educational conferences throughout the year. The typical format for this is that each week, on average, we have about 4 one-hour conferences at noon each day. The focus during these conferences is on active learning, and each week we have a pulmonary critical care case conference with discussions between fellows and faculty. We also have a weekly research conference where both internal and external speakers are invited to present some of the exciting research that they're doing. In addition to that, every quarter we have a morbidity and mortality conference to review events that have come up and learn from issues that arise during training. There are simulation conferences, ultrasound, as well as supplemental lectures on various aspects related to practice management, billing, contracts, leadership, financial health. An exciting recent addition to our conference curriculum is a multidisciplinary critical care conference that occurs each week on Fridays, and this is a collaboration between not only the Pulmonary and Critical Care Division, but also the surgical intensive care colleagues, anesthesia, and neurocritical care. And it's really a very rich learning environment where people from different areas come together to learn from one another.
My name is Avi Cooper, and I am the Assistant Program Director of the Pulmonary and Critical Care Fellowship here at Ohio State, and I am going to be talking to you about some of the other educational opportunities that we offer our fellows, particularly various master's degrees. First is the Master's in Medical Science program. This is oriented toward physicians in training who desire to have a research career in academic medicine. It can help transition from being a trainee actively involved in research to a junior faculty member who is working to be an independent investigator and grant-funded researcher, or as a medical educator with a focus on educational research. It offers individualized electives and seminars. There's a requirement for a mentored research project, and it can be incorporated into a fellow's schedule generally fairly easily. Next is the Master's in Biomedical Education program. This program offers formal training in educational philosophy, learning theory, educational leadership, and adult teaching practice, and there's a specific focus on biomedical education. There's also a component of educational research that participants in this master's program do to prepare for clinical and academic educational leadership roles in the future. Most of the program is online, and there is one evening course per week. This allows for integration into a fellow's clinical schedule. There's the Master's of Business Administration, or the MBA, at the Fisher College of Business, which is one of the top business schools in the country. The program is quite rigorous. It's oriented toward working professionals so that it can be incorporated in a part-time fashion. And many faculty at the medical school who are interested in administration at the hospital level take this, enroll in this program, and it is open to fellows as well. And finally, the Masters of Public Health. There are flexible part-time options for people interested in a public health degree, and there is an opportunity to have different focuses within the degree, whether on becoming an epidemiologist or health policy focus, and there is a culminating project that is required. One of the big benefits of being at Ohio State and enrolling in a master's degree program is it is mostly covered by the university. There is some out-of-pocket cost in terms of fees that fellows pay for, and past a certain point, the tuition is subject to taxation, but the out-of-pocket costs are fairly minimal compared to the overall costs of these programs, which is a big benefit for fellows. For our graduating fellows, we have a mix that go into academic positions or private practice, and some do fellowships afterward as well, whether in IP or sleep or lung transplant. And we're very proud of our fellows and the clinical training and academic preparation that they've had. And we look forward to celebrating our fellows every year at graduation. These are pictures from our fellowship and other members of the division at ATS and getting together socially. And we're very proud of the culture of our division. We're a supportive group, family oriented, and really taking care of each other very seriously, and we enjoy spending time together. This past June, our division director, Dr. Horowitz, was generous enough to host our program at his home for a end-of-year celebration to say goodbye to the graduating fellows and just to be together as a program. It was very special. And after saying goodbye to our graduating fellows, we were excited to welcome new incoming first-year fellows to our program to begin their training with us. And one of the things we were particularly looking forward to with the new incoming fellows was welcoming them to Columbus itself. Columbus is the 14th largest city in the United States. It's got metropolitan style with small town charm. It's affordable, diverse. There's wonderful food and sports options, including Buckeye football, Major League Soccer. There's an NHL hockey team and a minor league baseball team. It's been rated as one of the most intelligent and happiest cities in the United States. And there's also a terrific metro park system with wonderful hiking and biking options. And reflective of that culture and diversity and different opportunities, Columbus was rated by the New York Times as one of its 52 places to go back in 2019. Overall, Columbus is just a really fun place to live and explore. Finally, we as a fellowship program would like to emphasize our commitment to the principles of diversity, equity, and inclusion, as well as social justice. We have developed a longitudinal DEI curriculum for the fellowship, and our fellows are involved in engagement with community health initiatives to help increase the access to care and overall health of the community. And we are also participating in Ohio State's institutional anti-racism action plan. We'd like to thank you for your interest in our program and for taking the time to learn about the different training and career development opportunities that we have to offer. If you'd like to learn more, you can check out our website or our Twitter account for the fellowship, which is OSU_PCCM_fellows. Feel free to reach out to any of us in program leadership at any time. Our emails are included here, and we're all active on Twitter as well. We look forward to meeting you on your interview day. Take care.